Our first topic for today is how to determine the type of blood gas abnormality or how to interpret arterial blood gases. So remember that there are three steps in determining the three-step approach should be used to determine the acid-base abnormality on arterial blood gas analysis. So the first step is to see the pH. Is the patient acidemic or alkalemic? If pH is less than 7.35, then we'll label it as acidemic. And if the pH is more than 7.45, then we'll label it as alkalemic. The second step, we'll see the respiratory component. And in the third step, we'll see the metabolic component. So remember that partial pressure of carbon dioxide is the respiratory component. So whenever there is a respiratory acidosis or respiratory alkalosis, partial pressure of carbon dioxide or will increase or decrease. So for example, if in the first step we saw that the patient is acidemic, his pH was below 7.35. Now to determine this, the cause of this low pH, we will need to look at two things. The first is respiratory component and the second is metabolic component. When we are talking about the metabolic component, we are talking about the bicarbonate level or base excess. Remember that carbon dioxide is basically an acid and bicarbonate is an alkali. So an increase in the carbon dioxide means acidosis, and a decrease in the partial pressure of carbon dioxide means alkalosis. And because bicarbonate ions are alkali, so an increase in bicarbonate ion is alkalosis, and a decrease in bicarbonate ion is acidosis. Remember these points to correctly identify the acid-base abnormality. So in the first step, we'll look at the pH, and I will determine if it's acidemic or alkalemic. Now, for example, in the first step, we have an acidemic or acidosis or pH is less than 7.3. Now, first of all, we look at the respiratory component. If in acidosis, what should happen to partial pressure of carbon dioxide? Partial pressure of carbon dioxide should increase in acidosis. So if pH is acidic and partial pressure of carbon dioxide is increased, then I will say because the low pH is due to increased partial pressure of carbon dioxide, so we'll label it as respiratory acidosis because the low pH is due to increase in the partial pressure of carbon dioxide. So we'll label it as respiratory acidosis. Now remember that whenever there's a problem in the respiratory system or the pH low or high is due to respiratory system, the compensation will be metabolic. So we are doing an example in which pH is acidic and partial pressure of carbon dioxide is increased. So we have labeled it as respiratory acidosis. Now we need to determine what would be the compensation for respiratory acidosis. So to compensate respiratory acidosis or high pressure of carbon dioxide, the body will compensate it to metabolic component. So what should be the compensation in case of respiratory acidosis? Keeping in mind that bicarbonate is an alkali. So bicarbonate ions should increase or they should decrease in case of respiratory acidosis. Who will answer me this one? A patient with respiratory acidosis, in compensation, what should happen to bicarbonate ions? They should increase or they should decrease?
They should increase.
Increase.
Increase, yeah.
Anyone?
Decrease.
I think they should increase.
I said increase.
Dr. Musharrat, can you please tell us?
Yeah, they should increase bicarbonate ions, so there will be a compensatory metabolic alkalosis.
I'll repeat again the points. The first point that you need to remember is that carbon dioxide is an acid and bicarbonate ion is an alkali. So whenever there's a respiratory problem, compensation will be metabolic. And if metabolic problem, compensation will be respiratory. Remember this second point. First point is if carbon dioxide is an acid and bicarbonate ion is an alkali. The second point is if there is a problem in the respiratory system, compensation will be metabolic. For example, if pH increase or decrease is due to partial pressure increase in or decrease in the partial pressure of carbon dioxide. For example, in the example we are doing that the patient pH is low due to high partial pressure of carbon dioxide. Now, to compensate this high acid in the body, how will body compensate? So increase in partial pressure of carbon dioxide will be compensated through metabolic component. And metabolic component is bicarbonate ion. And bicarbonate ion is an alkali. So in the body, acid has increased. So the body will increase alkali too. To compensate this acidosis, the body will increase bicarbonate ion. So the compensation will be metabolic alkalosis. For respiratory acidosis, the compensation should be metabolic alkalosis. The opposite should happen. The opposite of respiratory is metabolic, and the opposite of acidosis is alkalosis. So the body will increase bicarbonate ions. Is this point clear to everyone?
Yes, sir.
So I hope it's clear to everyone because no one is asking any questions. So
It
now
is
we'll repeat three-step approach to determine the acid-base abnormality. First step is to determine the pH. Second step is to look at the respiratory component. If partial pressure of carbon dioxide is increased, then it means either it is a respiratory increase due to respiratory acidosis, or it is a compensation for metabolic alkalosis. The compensation will always be opposite to the basic acid-base abnormality. So if partial pressure of carbon dioxide is increased in ABGs, then either it is respiratory due to respiratory acidosis, or it is due to a respiratory compensation for metabolic alkalosis. So first step is to determine the pH.
Can I
Second step
ask
is
one question?
respiratory component.
Sorry, can I
Third
ask
step
one
is to
question?
look at the metabolic component, that is bicarbonate ion. The normal level of bicarbonate ions are between 22 to 26. And the low bicarbonate means acidity.
Sorry, one
high
question, please.
Because bicarbonate ions are alkali, so low alkali means high acid. So if the bicarbonate ion are less than 22, then it will be metabolic acidosis. Or if the bicarbonate ion are more than 26, then it will be metabolic alkalosis. Either metabolic alkalosis or a compensation for respiratory acidosis, because the compensation for respiratory acidosis will be metabolic alkalosis. So this is a three-step approach. Another way to determine metabolic component is to look at base excess. If base excess is less than -2, then it is acidosis, metabolic acidosis. And if base excess is more than 2 or +2, then it is it will be metabolic alkalosis. So are these points clear to everyone? If is there any confusion, you can ask. And if you people don't ask, then I'll ask the questions to see that if it's clear to everyone or not.
Can I ask a question about the partial CO2 when there is too much washout of carbon dioxide? So it's in that condition, the patient will have low
So
acid.
it's better to ask questions.
Hello, can you hear me?
So Dr. Sumbal will tell us what will be the compensation in metabolic alkalosis.
Sir, respiratory component. There will be respiratory
Dr.
compensation.
Musharat, I cannot hear you.
Okay. I was trying to ask question. You can't hear me?
I can hear you.
Yeah, I can also hear you.
Dr. Shafraz, I'm not able to hear you as well.
They can't
Think there
hear
is
me?
a problem with my, let me